welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today in the show, we welcome back Armin Feldman. He is a physician and medical consultant to attorneys. He wrote the Kevin MD article, Medical Legal Consulting as a Side Gig. Armin, welcome back on the show.
Hi, Kevin. Pleasure to be back. Nice to see you.
So we'll get into your article in a little bit, but for those who didn't get a chance to listen to our first episode, that was more than a year ago, if you could just briefly share your story and journey to where you are today.
Sure. So my background is that I'm trained as a psychiatrist and psychoanalyst, and almost by accident, my specialty wound up being mild traumatic brain injury. And I wound up owning outpatient head injury rehabilitation clinics around the country, treatment program of my own design. And I was fortunate enough to sell those. And after I sold them, I was thinking about what I wanted to do next. And as part of my work, I've testified as an expert witness, more times than I want to remember, on behalf of my patients who were either being cut off of their medical care or offered some pittance of a settlement. So I was thinking about what I wanted to do next. And I thought, well, my background also, my internship was in internal medicine. And I thought, well, maybe what I could do is just consult to attorneys on any kind of medical question that they have in a case. And that turned out to be an unfulfilled niche. Now it's 15 years later, and I've developed that really into a new subspecialty of forensic medicine that involves civil cases, not criminal cases. So I work with personal injury and workers' comp attorneys, helping them to better negotiate and settle those 8 or 9 out of 10 cases that they bring to settlement and don't take to trial. And since that time, I realized that other physicians could do that. For the past 14 years, I've been training other physicians on how to do this kind of work.
So we'll certainly talk about that in a little bit. But before we get into that, tell me some of the rewards that you get from being a medical consultant to attorneys.
Yeah, I think the biggest thing is that this is a great way to use your hard-earned medical knowledge in a non-clinical field. But the key is knowing that you're still really helping people. You're helping people that I think we all get into medicine to help people, right? So it's a way to help people that desperately need this help, didn't have this help apparently prior to my starting to do this. And you can see the tangible results of working with the attorney and helping that attorney to increase the case value and help the attorney get the appropriate medical care for their clients. If I could give you a really brief example. There are doctors, obviously, I'm sure you know, that do independent medical exams, and there are great doctors that do great IMEs. What we also know is that in most communities across the country, there's always a group of physicians that do IMEs and kind of know what the outcome's going to be before the exam. And I was the first physician, I think I was the first physician in the country to actually physically sit in on these IMEs and putting myself in a position to help the attorney and write an IME rebuttal report. So now you could balance when a physician is hired by the insurance company to do the IME, and now the client, the injured person, can have a physician there at the IME on their behalf and put them in a position to refute that IME if it's appropriate to do so. So that's just one way out of many ways that we can help people that really weren't helped before.
So let's talk about your Kevin MD article. It's titled Medical Legal Consulting as a Side Gig. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah. So I think the why is fairly obvious to you and anybody listening to this. There's been this massive shift in the way physicians practice medicine, and we all know about the death of private practice. And so almost all physicians now are employees of big corporations or hospital systems. So what's the natural outcome of that? I saw in a recent survey that over 25% of all physicians practicing clinical medicine are looking for a side gig that they can call their own. That is something that they control, that they want to do, that is outside the purview of somebody looking over their shoulder with them as an employee. So side gigs probably is the biggest trend for physicians today. And so there are all kinds of things physicians can do, but one thing they can do is they can become a part-time medical legal consultant. Now, I train physicians to do this. Some physicians do it full time, some do it instead of retiring, but the vast majority of physicians that do it as a part-time side gig in addition to whatever else they're doing. And it gives them that opportunity to be independent, have a lucrative income, do something interesting, help people, and have something that's all their own.
Now, for those physicians who are interested in doing medical legal consulting as a side gig, take us through some of the common questions that these medical consultants are asked about.
Yes. So, as I said, the two main areas of attorneys interested in this are personal injury attorneys and workers' compensation attorneys. So, a physician in any specialty can learn how to do this. And I've trained physicians, soup to nuts in terms of specialty, but these are primarily injury cases. So the service actually that is the most requested service is to provide comprehensive medical summary reports with our medical opinions that attorneys use as part of settlement demand letters. So when a case is settled, in every state, there's kind of a set format for these letters. And obviously, one of the things that need to be put in these letters are what are the damages? And in most cases, the biggest damages are the medical damages. And so what we do as medical legal consultants is we look at the entire case. We talk to the attorney. We read the medical records. We interview the client of the attorney. We do the appropriate research. And then we're looking at every injury in the case. And we are giving our medical opinions on what are the injuries. We're talking about causation, mechanism of action, functional losses, backing up that with evidence from the medical literature. We're talking about future medical care and costs, things that have a monetary value in these kinds of cases. And the consistent feedback through the years with me and physicians I've trained is that with attorneys using these reports, they are in fact settling their cases for better value, more money, less attorney time, and they're getting the appropriate medical care for their clients.
How many hours would a physician need if they wanted to do medical legal consulting part-time and still have it as a viable side gig?
Yeah, that's a great question. So you need at a minimum about 8 hours a week in order to do this justice and make it fly. Now, the majority of those 8 hours, they need to be during the regular work week because you need time to meet with, talk with attorneys who obviously are your clients and talk with their clients, the injured person. So about 8 hours a week is the minimum. And many physicians will start at that and then they'll build that up. They may go to 15, they may go to 20, whatever suits them and what they enjoy.
Are physicians able to do this nationwide, or are they limited to their local attorneys that they have to work with?
Right. And again, it's a really great question. And the answer is almost all of these businesses are local businesses. By the nature of the business, the marketing for the business, and the fact that there is such a high demand in every place in the country, it doesn't really make sense. It's not really even practical to try to do this on a wider basis than that. Plus, one of the keys to being successful at this from the business side, from marketing side, is you want to establish long-term relationships with your clients. And you're much better able to do that when you're working with attorneys in your local area.
Now, don't attorneys already have lists of physicians they typically go to? And if you're a physician just starting out with medical legal consulting, how do you break in and meet these attorneys when they probably already have established relationships with other physicians that they go to?
Yeah, again, you're asking such great questions. But so when doctors and lawyers think about lawyers hiring doctors, they really only think of one thing, and that's hiring experts, expert witnesses, medical experts. And so one of the things that we do and that I teach is you need to educate attorneys as to what it is that we as medical consultants in legal cases, as opposed to medical experts, bring to the case. And when you do that, it's not uncommon that the attorney will say, well, I've never heard of a doctor doing this. And so you really need to educate your potential clients what you do, how you do it, what are the services that you provide. And oftentimes when you do that, like with the cartoon character in the balloon, you could almost see the light bulb going on off on top of their head. And so now they will use medical experts when that's indicated, but they're much more likely to bring you on as a PRN part of their team on cases. Some attorneys will have me on every case, if I would want to do that. But that's the big difference. And so it's just a matter of helping the attorneys to understand how you can benefit them, the case, the client.
So, realistically, how long does it normally take for a physician to learn the ropes and have medical legal consulting as a viable part-time side gig?
Right. So through my training program, one of the things is a detailed step-by-step business launch plan. That'll take you from zero to up and running with your business. Up and running is defined as now being in a position to start soliciting business from attorneys. If you put your mind to it, you can get through that in about 3 weeks. Physicians doing this on a part-time basis, 3 to 6 weeks. From the time that you start soliciting business from attorneys to the time that you should start seeing some cash flow, if you are an average with other physicians around the country doing this, it's about 3 months. And from that point forward, you'll make money, see clients, have cases, and the amount of money you make is completely related to how many hours you put into it.
Now, other than the training, are there any other upfront costs a physician has to consider?
Well, you're starting your own business, but one of the nice things about this business is what I tell people is the costs up front are minimal. The biggest cost up front is elbow grease. And that's for the learning, it's for marketing. It's more of a person-to-person business than there are some upfront costs. I mean, you need to buy some domains, you need to get basic stuff like stationery and an accounting system and all that, but minimal cost.
We're talking to Armin Feldman. He is a physician and a medical consultant to attorneys. He wrote the Kevin MD article, Medical Legal Consulting as a Side Gig. Armin, you mentioned that you had a training program. Can you talk a little bit about that, as well as other resources physicians can utilize if they wanted to get started up with this?
Sure. So right now, physicians have two options with regard to learning this. I do have a new course coming out in March. It's an online course, pretty much self-directed, although at the end, it's an 8-week course, but at the end of each 2-week module, I do a live Q&A. That's one way. And then I have a more, obviously more intensive, it's a 1-year training program, my medical legal consulting coaching program. And that's on the business side. It's on the medicine you need to know. And of course, it's a year of coaching with me. So those are the two ways. I'm sure most of your physicians listening to this are probably getting emails about the new course coming out, emails from me. But and of course, the coaching program now is in its, I think it's 12th or 13th year.
Are there any downsides that you could see from expanding a practice into medical legal consulting?
Yeah. I don't really see any downsides. By the way, this is maybe related, but the biggest reason why physicians, if they fail at it is they don't take it as seriously as anything else that they do in their professional lives, or they don't carve out the minimum number of hours. But I mean, if you don't do those things and just follow the system, follow the recipe, it works for physicians all over the country. So it's interesting. You get to solve a lot of medical puzzles. I've learned a tremendous amount of medicine. I'm in no position to do any orthopedic or neurosurgery, but I put knowledge base of spine injuries, rotator cuff injuries, other things up against anyone. And for me, that's been a lot of fun of doing the work. I love medicine. I know I'm a better, more well-rounded physician based on all the research I've done over the years.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
So I think the biggest message is if you're like at least a quarter of the physicians in the country and you're looking for something to do in addition to your main job, and you want something that's interesting, lucrative, helps people, and actually is fun, I would suggest you consider this. And I'm happy to talk with anybody who's interested.
Armin, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thanks, Kevin.